Hello AP students, this is Mrs. Politsky and I have notes for chapter 13 and we're going to talk a little bit about the biomedical approach. So, how is the biomedical approach used to treat psychological disorders? Well, biomedical therapies attempt to treat these disorders by intervening directly in the brain. Biomedical therapies seek to treat psychological disorders by changing the brain's chemistry with drugs, its circuitry with surgery, or the pattern of activity with pulses of electricity or powerful magnetic fields. Each biomedical therapy emerges from the medical model of abnormal mental functioning. Let's talk about drug therapy or psychopharmacology. Drugs can calm anxious patients and restore contact with reality within patients and suppressed hallucinations in psychotic patients. In 1953, antipsychotic drugs, such as tranquilizers, were first prescribed, allowing thoughts of disordered patients who had previously been absorbed in their delusions and hallucinations to begin to respond to the physical and social environment around them. Many of these drugs were a replacement for the fact when people were having prefrontal lobotomies, which for the most part didn't necessarily always fix the problems that certain patients were having, but the tranquilizers and other antipsychotic drugs for the most part were the best thing at that moment in time. The effectiveness of drug therapy had a pronounced effect on the census of the nation's mental hospitals. By 1953, over 500,000 Americans were living in mental hospitals, each staying an average of several years. With the introduction of tranquilizers, the number of people staying in mental hospitals started to decline. In just over 10 years, so roughly 1965, fewer than half the number of the country's mentally ill were in hospitals. Today, millions of people take drugs for anxiety, stress, depression, hyperactivity, insomnia, obsessions and compulsions, addictions, fears, phobias, and numerous other problems. Prozac and Valium are two psychoactive drugs that alter your moods, perceptions, desires, and your personality. There are roughly 4 categories of these drugs. There are antipsychotic drugs, antidepressant drugs, and mood stabilizers, anti-anxiety drugs, and finally stimulants. So, antipsychotic drugs. These are medicines that diminish psychotic symptoms. That would be like your delusions and hallucinations, usually by their effect on dopamine pathways in the brain. Most work by reducing the activity of the neurotransmitter dopamine in the brain, although precise reasons why this has an antipsychotic effect is not known. Chlorpromazine is an example, and haloperidol are known to block dopamine receptors in the synapse between the nerve cells. Clozapine decreases dopamine activity and increases the activity of another neurotransmitter, serotonin, which inhibits the dopamine system. These drugs reduce overall brain activity, but they do not merely tranquilize the patient. They reduce positive symptoms of psychosis, although they do little for social distance, jumbled thoughts, poor attention spans, seen in patients with negative symptoms of schizophrenia. Long-term administration of antipsychotic drugs can have several negative side effects, though. Physical changes in the brain have been noted. Something known as tardive dyskinesia, which is an incurable motor control disorder, involves muscles of the face and the head. It's kind of like a tic for the most part, resulting from long-term use of antipsychotic drugs. And then argoglanocosteosis is a blood disease that is caused by bone marrow dysfunctions. Antidepressants and mood stabilizers. These are drugs that are used to treat depression and bipolar disorder, but no drug provides a cure. Antidepressant drugs, these are medicines that affect depression, usually by their effect on serotonin and norepinephrine pathways in the brain. Trilysic compounds, such as tofranil and Elavale, reduce the neuron's reabsorption of neurotransmitters after they have been released into the synapse between the brain cells, or reuptake. A second group of antidepressants includes Prozac. These drugs are known as SSRIs, or selective serotonin reuptake inhibitors, because they selectively focus on preventing the reuptake of serotonin. As a result, the SSRIs keep serotonin available in the synapse longer, preventing its inactivation and removal. This prolonged serotonin effect dramatically lifts the depressed moods. A third group of antidepressants are known as monoamine oxidase, and these are a type of MOA inhibitors which limit the activity of the enzyme MOA, and a chemical that breaks down norepinephrine in the synapse. When MAOs is inhibited, more norepinephrine is available to carry neuro messages across the synapse. The possibility of suicide is a special concern when considering antidepressant therapy. It usually takes a few weeks for antidepressants to have an effect. A long time to wait if the patient is suicidal. There is an alarming increase in suicides in the month after the patients begin taking antidepressants. Even more worrisome is the possibility that the drugs themselves may sometimes contribute to suicidal thoughts by making depression worse before it gets better. Controversy over the SSRIs, particularly Prozac advocate Peter Kramer, encouraged the use of the drug to deal not only with depression but also with general feelings of social unease. The fear of rejection would be an example of that. Such claims have brought heated replies from therapists who fear that drugs merely mask the problems that people need to face and resolve. Some worry that the wide use of antidepressants may produce a change in personality structure of a huge segment of our population. More prescriptions are being written for antidepressants than there are people that have been diagnosed as being clinically depressed. Mood stabilizers. Lithium carbonate. This is a simple chemical compound that is highly effective in dampening the extreme mood swings of bipolar disorder. Lithium is not just an antidepressant, but it affects both ends of the emotional spectrum, dampening swings of moods that would otherwise range from uncontrollable periods of hyperexcitement to lethargy, or being lethargic, and despair of depression. Lithium in high concentrations can be very toxic. Physicians have learned that small doses can be given to build up the therapeutic concentrations in the blood over a period of a week or two. Patients must have blood analysis to ensure that the lithium concentrations have not risen to a dangerous level. Promising alternatives to lithium includes divalproex sodium, originally developed to treat epilepsy, and this seems to be more effective than lithium for most patients. Anti-anxiety drugs. Anti-anxiety drugs, this is a category of drugs that includes barbiturates and benzodiazepines drugs that diminish feelings of anxiety. These drugs that are often prescribed for problems that people should face rather than masking with chemicals. Barbiturates act as the central nervous system's depressant, so that they have a relaxing effect. Barbiturates can be also dangerous if taken in excess or a combination with alcohol. The benzodiazepines such as Valium and Xanax work by increasing the activity of the neurotransmitter GABA or GABA, thereby decreasing activity in the brain regions more specifically involved in feelings of anxiety. Hence, they are like a minor tranquilizer. Some cautions with working with anti-anxiety drugs. These anti-anxiety drugs work by sedating the user, and if used over a long period of time, these drugs can be physically and psychologically addicting. These medicines should not be taken to relieve anxieties that are a part of ordinary stresses of life. These drugs should not be normally taken for more than a few days at a time. If used longer, their dosage should be gradually reduced by a physician. Abrupt cessation after prolonged use can lead to withdrawal symptoms, such as convulsions, tremors, abdominal and muscle cramps. Anti-anxiety drugs depress the central nervous system, and they can impair one's ability to drive and operate machinery or perform tasks that require alertness. In combination with alcohol or with sleeping pills, anti-anxiety drugs can lead to unconsciousness or even death. Stimulants. Stimulants, these are drugs that increase the activity of the central nervous system by encouraging communication among neurons in the brain. Stimulants, however, have been found to suppress activities in persons with attention deficit hyperactivity disorder. Sometimes they can be used to treat people with narcolepsy, and as I mentioned before, with attention deficit hyperactivity disorder, or ADHD. This is a common problem in children who have difficulty controlling their behavior and focusing their attention. Ritalin is a stimulant that it may seem strange to prescribe a stimulant for ADHD, but studies where both behavior therapy and drugs were tested has proved that the stimulant's effectiveness. Stimulants work in hyperactivity children by increasing the availability of dopamine, glutamate, or serotonin in their brains. The use of stimulants to treat ADHD has generated controversy. Stimulants will interfere with normal sleep patterns. Additionally, there's evidence that stimulant therapy can slow the growth of children. Evaluating drug therapies. Well, the drug therapies have caused a revolution in the treatment of severe mental disorders starting in the 50s. None of the drugs discovered so far can cure mental disorders. Elliot Wallenstein, who you see below, believes that much of the faith in drug therapy for mental disorders relies on hype. He credits the wide acceptance of drug therapy and the huge investment of drug companies that have been made in the marketing of their products. There are concerns about the willingness of physicians to prescribe drugs for children, even though the safety and effectiveness of many of these drugs has not been established on young children. The apparent advantages of drug therapies are quick results and low cost. Thank you very much.